is hot, but the baby is soaked in a sweater, covered with a blanket, then a baby shock.
Hi everyone, so Aggie as usual. Today it's not as usual. Our visitor or a guest for us, and
I'm Whitney Justin, a fifth year medical student doing bachelor's degree in medicine and surgery.
today we are going to look at fevers. This happens after I met some lady who had a baby. The baby used to have on and off fevers, but this lady brought the child to the hospital, and the management she was giving at home was always Panadol. So let's dive into that topic of fever. Pass through Dr. Whitney, what is fever to our parents?
Okay, so fever is when we have the body temperatures rise abnormally. Like for a mother, you might have your baby, but there is when you hold the baby and you feel that they are hotter than the usual. So most of the times you may not have a thermometer to detect it, but if you ever feel that your baby's body temperature is very hot than the usual, then you will detect a fever. But if you're modern enough, like in our homes today, it's very easy for someone to afford a thermometer. So if you use it and you realize that the temperatures are 37.5 and above, then you confirm that your child is having a fever.
And our parents or our dear viewers, when they bring their children to the hospital, they will always use the word omwana alinamu ka temperature. So meaning what we are talking about, you're very well versed. When should I worry, doctor, about this fever?
Like we have said, fever can come as a physiological reaction to the body. For example, if you've taken your child for immunization, it can be normal for them to experience some fever, some changes in their body temperatures. But again, this fever is a symptom for various disease conditions.
Yes.
So if a mother, you know that, oh, I'm just from immunizing my child, you can give it a little time, that fever can go away. But then you have to worry. If your child has been doing well, then they develop fever, and then maybe you notice some other things. If your child has had a cough, if your child has body swelling somewhere. So you just have to be a very, very concerned and careful parent to notice the different changes and how your child has been.
What about these mothers who are ever on internet trying to search? What advice can you give them in times of worry?
In times of worry?
Like Google,
Okay, we have very many Google patients actually in our condition. Meta, AI, ChatGPT. Okay, yeah, we are living in an informed generation, but it will always be good if you go and see a medical worker, because you can't study medicine or a disease within 5 minutes.
Hope our viewers, you're trying to really digest this. Doctor, I would love also to ask, what should I do as a mother, as a parent, as a caretaker when my child develops this fever?
Oh, actually, that reminds me of the first aid, like we grew up. Before our parents take you to hospital, there are some interventions we can do at home. And for the fever, the first thing, sometimes a mother can come to you, oh, my baby is hot, but the baby is soaked in a sweater, covered with a blanket, then a baby shock. So the first thing is you need to expose the child. If you've been covering the child with a lot of clothing, the first thing is for you to expose and let fresh air come through the baby. That might actually help relieve the fever before you even come to hospital. Then secondly, there is something we call tepid sponging, whereby you will get either a small piece of cloth or a sponge, and then you get some lukewarm water. Soak it there, press it, and then put it around the baby's body or the child's body. That will also help relieve the fever.
Alright. What would you advise? Shouldn't we use this very cold water?
No, we need to use room temperature water.
The water that we always use, which is outside the fridge.
Not so hot, not so cold, just room temperature, normal temperature.
Alright, thank you very much for today's topic.
Oh yeah, as I conclude, I want to talk about self-medications with fever, especially in our young children. Mothers, I know you can be having your paracetamol, Panadol at home, but if the child gets a fever, do not overexpose them to these medications, because their livers have not yet fully developed. And it's not that every fever requires you to give that antipyretic. So for the best thing, if your child gets a fever and it's persistent, go to a hospital, go to a clinic, seek medical intervention such that we may find the underlying cause. Like we've said, fever is not a disease, but a symptom.
In
for
other
a
words,
disease.
she's saying fever kabonero bubonero akajjayo ebyekwese munda for the health workers. Thank you so much, Dr. Whitting, for your time and also for the good sharing you have done.
It's been a pleasure having you here and hosting me, and I would encourage us to keep viewing, keep subscribing, liking, and press the share button, because this is very important and educative information.
So for that matter, we're saying we love you so much. Mwah.
Bye bye.